Good morning, everybody. Welcome to the November 15th, 2021 Grants Pass City Council Workshop. Who do we have on the phone today, Karen? Is it Vanessa and DJ? Okay. So Vanessa Auger and DJ Fazier on the phone, and we are missing Rob Pell at the moment. On our agenda today, we're going to be hearing from some public health, mental health, addiction services providers, and it looks like the city manager, Aaron Kubick's ready to get us started.
Good morning, Mayor, Council. Subject today is Council's information sharing on public health, mental health, and drug addiction. Of course, relations to your Council goals to enhance community safety and provide cooperative shared leadership involving Council staff and the community. So there's three main entities here today to provide you some information on the subject matter. Dr. David Candelara from Josephine County Public Health, Carla McCafferty and Shelley Urig from Options, and Sean Martinez from Josephine County Prevention Coordinator. So up first, we'll have Dr. Candelara come up and provide you with a brief presentation. What I mentioned to them is that they'll come up and they'll provide you with some information, and then maybe, Mayor, if you'd like, you could do specific questions of what they've talked about, and then we'll bring up the next ones, do the same thing, and at the end have an additional general question and answer session. So they're prepared to answer any questions after their initial presentation, and then we can move on to the other ones. And with that, I'm happy to introduce Dr. Candelara.
Good morning. From your email, it sounded like you wanted an overview of public health services currently in Josephine County, and then later think about how this could apply to a houseless population and what else public health might be able to offer. Currently, public health has been continuing to do a lot of reproductive health and sexually transmitted disease work. Pre-COVID and even through COVID, syphilis cases have been rising and rising, and so for various reasons it's been a difficult condition or public health threat to manage. We used to have an idea of which populations were at high risk of transmission of syphilis, but that seems to be a broader scope now, but still we provide outreach and confidential testing and treatment. Other aspects of public health involve addressing domestic violence. So we have a nurse on the staff who's worked with Jackson County to try to get ways for citizens who might be victims of domestic violence to have a easy outreach to other community partners to provide them safety or at least counsel. Currently, obviously, the COVID pandemic has occupied a lot of public health time, and we've done a lot of outreach which mirrors earlier outreach in terms of testing and vaccine and other treatments for COVID. Prior to COVID, we did have outreach with flu testing, and we did that in various entities. That seems to be still a pretty good way to get that kind of medical care out to the community rather than having a central ivory tower where people would come and get vaccinated. We actually try to do a better job getting out, and that model worked particularly well with COVID testing and vaccination. So that's something that we continue to try to promote as best we can. And then we're also part of conversations on warming centers to try to provide increased safety for a houseless population. In terms of the houseless people who ended up in our COVID management, we partnered with other community entities like UCAN to try to arrange shelter and housing for them and facilitate any medical oversight. The strengths we have at Public Health to do our job are committed and driven staff and the partnerships we have with other community entities like UCAN and All Care Health. Weaknesses in public health are a limited public health staff. We were much better staffed years ago, but currently we have almost a skeleton staff that does what they can providing reproductive health services through the clinic, and that's pretty much the clinic's limit right now is reproductive health. We don't really see people for any continuity of care or any urgent care issues, although if someone who's already seen a public health as a reproductive health patient has another urgent medical condition that's manageable with the limited resources of public health, we can do that as well with our providers. Opportunities to enhance public health's effect on the community center around trying to get better relationships with press. They're really the voice of public health because there's only a few of us, so we can't go everywhere at every meeting and present what we can offer. And threats to public health's ability to continue its work are fundamentally funding. That comes and goes seemingly at whim of politics. What we do the best we can. I think an example of that funding frustration was a tobacco tax that was recently passed, and there was an expectation that at least some of that money would come to public health to do its work, but ultimately that money got diverted to other agencies of worth. But again, it makes it harder to do what we'd like to do, so we do what we can. And lastly, I just would like to comment on a challenge, particularly with this houseless population, because it came up early when we were trying to decide what are we going to do with people who are houseless who test positive for COVID. We want to keep them isolated or quarantined, so we spent a lot of energy trying to figure out how we were going to do that. But in our conversations with people who do that kind of work, like you can, we were reminded that a fair amount of the houseless population kind of prefer to remain out of the mainstream. So it's difficult to get to them and provide the outreach. An image that goes through my head is some of the houseless people perhaps live under the bridge, right? In or not in a tent. And when we have thought about doing outreach for flu vaccine or something like that, we say, well, if we're going to go into that kind of environment, we want to be safe. So we would send 2 people to a situation like that for safety, but sometimes we just didn't have 2 people to go just because we're stretched so thin. So their environments, the concerns about safety, and in general, we kept being reminded by our partners that these are people who pretty much, some of them really want to be left alone. They're not particularly going to be interested in offers of this, that, or the other, unless something really compels them. Sometimes we see that in the ER when the weather gets cold or rainy. Houseless people will show up in the ER, chest pain, or have laboratory abnormalities, and they get put in and watched overnight, but that's obviously not a good solution. It's certainly not an inexpensive solution. But I'm not sure, and I'd be interested to hear what other speakers might have to say about how do you reach a good segment of the houseless population. I don't think you're going to reach all of them, but is there a way to approach this houseless population that's more successful than not? And those are my thoughts now.
Thank you, Doctor. Are there any questions? Valerie?
Yes, thank you for presenting. I'm sure there'll be more questions as the day goes on. What percentage would you say, if you had to give a percentage of what percentage of the population you feel does not want or is not willing to get the help?
I don't have a number.
Okay.
And I don't even know if that's been studied. That would be an interesting question, but even getting the question to the people would be problematic.
Okay, all right, thank you.
Rick?
Thank you for the presentation. I know the rules on mental health have changed and you've expressed some of that, but pretty much everything today has to be self-referral unless, and maybe, I don't know, in an extreme case, the judge would then rule, the person would then have to be put into a program. So the reason for the question is a lot of the people that are homeless, and it's a known factor and statistically that they do have mental health problems, but unless they self-refer, you never get to talk to them. Has there ever been a I would say a program or an idea for you to go out and, I want to say, solicit those people to come and talk to you. But the trouble is, you're probably so short-staffed, you don't have that, I would say, opportunity or option to do that. Would that be true?
You know, I think that would be an excellent question for our options friends. I can't say that we've developed a targeted program where we said we are going to provide mental health outreach. We, public health, are going to provide mental health outreach to the population to see if we can address that problem. Again, usually we try to partner with people rather than take it on as a public health mission. But you're correct about the prevalence of mental health issues in the house's population.
Thank you.
Brian.
Yeah, thank you, Doctor. I'm over here. So you mentioned limited staff, and I would assume that is directly tied to funding at any given point in time. Is that
Yes.
accurate?
Yes.
Okay. And the funding fluctuations, where are those decisions made for your funding? Are those local decisions at the county level? Is that state funding? Is that federal funding? I'm wondering where those fluctuations largely come from.
It's all of the above. There are certain programs from the federal government that have lots of parameters about how you spend that money that provides us some latitude in terms of staffing, but core staff comes down to state funding and the decisions by county commissioners. So it's quite skewed now because money has been raining down during the pandemic. And as soon as that stops, it'll be interesting to see where we land and what programs we have that will continue to be funded. But fundamentally, as we work under county commissioners, they have a lot of weight in terms of what public health will receive in funding.
Thank you. And just to maybe get a little bit more clarity, can you speak to historically the level of funding that's been provided at the county level? Has it been fairly consistent? Does it fluctuate a lot depending on year to year?
In the recent past, I can't really speak about specifics and percentages, but it's been in quite a bit of flux because a handful of years ago, there was an idea to actually distribute all the public health services out into the community, just totally decentralize public health and reduce it to a core state mandated functions. That has not come to pass. We have retained this kind of skeleton crew to provide other services. Public health doesn't want to replace what's available in the community, rather augment it. So funding in the last handful of years has been up and down, mostly down, except for the COVID money. After this all settles, it'll be interesting to see how our society looks back and says, what was the value of public health during the pandemic? The curse of public health is that when it does a good job, nobody knows because diseases don't occur and other stuff doesn't happen, except for syphilis. For some reason, syphilis powers through. But that's what makes it hard to get funding because there's no headline screaming need when we do our job well.
Great, thank you.
Joel?
Well, I appreciate you being here today, and I appreciate what you do, Doctor. Unconditional respect, an important part of our community. I was looking up some statistics. Suicide is now the largest cause of death of our teenagers. It's up 31%. 31%. There's epidemic levels of addiction to meth, heroin, availability of marijuana and alcohol goes without question. Adult depression over the last 2 years supposedly has tripled nationwide. Have you seen an increase in demand for these services or an increased need in the community over the last 3 years?
I think of those three, probably substance abuse has been really most prominent locally. That use, particularly opioids, has increased. We've had more opioid deaths. We looked at suicide several months ago and saw it as a flat
Cool.
here in Oregon and locally, although last year they were saying next year is going to be the year when all the emotional and mental health collateral damage from this pandemic will occur. So I'm curious to see how these curves change over the coming months.
Okay.
Valerie?
Yes, I just have a question about, and I think this will become more apparent when Options comes up to give their talk, because it's my understanding that the public health, like you said, has primarily dealt with the reproductive issues, as well as, how about like restaurants and that, does that go through public health as well as, inspections and that sort of thing? Does that go through the Josephine County Public Health Department?
Yes, the Public Health Department has a couple of other services, environmental health, which includes restaurant inspections, clean water. We have some kind of distant relationship now with animal control. We used to be more in control of that, but that's largely under the sheriff's office now.
Okay.
We also do death certificates, dog licenses,
Okay.
other mundane stuff.
Okay, so it sounds like the mental health part of it, you actually is taken care of through Options and other programs, or, so you just
Yes.
kind of are the statistical place where it's recorded and things? I'm just kind of trying to get a feel for the services in the county.
Okay. Mental health is largely handled by other community partners, but all the statistics end up at the state, so that's where we pull them down to see what the trends are. WIC is another function of local public health, women, infants, and children.
Okay, thank you.
Are you planning to stay for the other presentations?
Yes.
Okay, let's have Options go, and then we'll circle back around if people have more questions for you after we've heard that. That way we don't get too many mental health questions directed your way, huh?
Thank you.
Thank you.
Good morning, Mayor and Councilor members. Actually, it's just afternoon now, so good afternoon. I'm Carla McCafferty. I'm the Executive Director for Options for Southern Oregon, and I'm here with my colleague, Chief Operations Officer Shelley Urig. So I'll go through the presentation, and then as there are questions, we can probably tag team on those. And I'm hearing there's probably going to be some questions, which I anticipated, so that's fine. So Options for Southern Oregon, let me just see where we're at so I can follow myself along here. We actually established, Options for Southern Oregon was actually established in 1981, and some people may know this or not, but a little bit of trivia. We actually started in what is now an empty lot there at the corner of A and 5th, which used to hold a little house, and then it later became the Mental Health Consumers Drop-In Center, and Options was located over where we are now, our administrative building on G Street, which used to be a school, as I understand, way back when. So we've come a long way since 1981, and let's see here. Oh, I got to touch this. It's not a touch screen, so just a second. Okay. So we provide mental health, addiction treatment, and primary care services in both Jackson and Josephine County. And as I said, 1981, we started in Josephine County, and in 2017, we developed outpatient services in Jackson County at the request of one of the local coordinated care organizations. And some folks will probably remember this, if not everyone, but for a long period of time, Josephine County was doing a lot of the services that we are now through their mental health department. And back in 2002, is that right, Shelley? No, 2006? Six. In 2006, Josephine County privatized the services to Options for Southern Oregon. So Options for Southern Oregon was already in existence as a private nonprofit, And the commissioners determined at that time to transition services to a private nonprofit that could really focus on mental health services in and of itself. And so that was one of the points in our history where we grew quite a bit with the types of services we were delivering and the number of people we were working with. So today, this list provides you with sort of a synopsis of the number of services we do now. And as you can see, we're involved in a lot of areas in the community. We'll talk a bit more about that in a moment. But it also includes the corrections population, for example, schools, housing organizations, supported employment, and education, those types of services. So, because folks who are struggling with mental health, and I think this is a really important point, it's usually not just mental health. They have multiple other issues in their lives that they're dealing with. The folks who may do okay with just getting therapy, for example, which is what most of us usually think about when we think about mental health. We either think about medications or we think about therapy. Those folks are generally served well by private practitioners in the community, or maybe even their primary care doctor for a medication they've been taking for a long period of time. We work more with folks who have multiple complex challenges. So, although we do work with that other population too, but a lot of our folks have multiple challenges. So you may have heard this term before, the community mental health program. Every county in Oregon has a community mental health program. And these community mental health programs are part of what's called the social safety net for the community. So there's services that the community mental health program provides that helps ensure the safety of people with severe mental illness. And those services are funded through the state, and they were housed with the mental health program when it was with Josephine County, and now they're housed with us as a nonprofit. So counties have the options of doing that in-house or contracting with a nonprofit to do those services. So when those were moved over from Josephine County Mental Health, when mental health was privatized, that responsibility moved with it to Options for Southern Oregon. And on this list are some examples of what that includes. So things like adult and abuse neglect investigations for people who are actively receiving publicly funded mental health treatment services, the training and referral, care coordination around psychiatric adult foster care homes. So these aren't senior homes, but they're homes specifically for people with an identified mental illness. Aid and assist, a lot of folks may not be familiar with this population, but it's been an increased area of scrutiny by the state in the last number of years because the state hospitals are being, most of their beds are being taken, or the majority of the beds are being taken up by folks from this population, and these are individuals who may commit a crime, a lot of times not a large crime, and they're not mentally in a place where they can aid in their own defense. And so the state has been really working towards those individuals being kept in the community instead of going up to the state hospital, and having the local mental health authorities work on getting them to a point where they're mentally able to understand the charges that are being held against them, and to be able to aid in their own defense. Folks that are on civil commitment, that was kind of mentioned earlier by Councilor Riker, I think, about the piece where this is one of the several options that are available to supportedly, for lack of a better word, I guess, force someone into treatment. And even that question, or push someone into treatment who's reluctant to do that, is by being on civil commitment. And that's really for folks who are at imminent risk to themselves or others. So imminent meaning really in the near future. And then also mental health crisis response to the hospital and to a variety of locations in the community. So that's just a subset of some of the community mental health program responsibilities that we carry. These are lots of jargon or acronyms. Our clinics in both Josephine and Jackson County are also certified as certified community behavioral health clinics. And this is really defined by the federal government through the Substance Abuse and Mental Health Services Organization. And there's been a real push in the last 6 years or so to help behavioral health organizations or mental health organizations start to do more wraparound services for people. So not just looking at mental health, but what's the physical health? Because folks with significant mental health issues also have a lot of co-occurring medical conditions, addictions issues, care coordination around all those services so that somebody's kind of keeping track of everything someone needs. And also a big piece that we've also worked on with options that's part of the CCBHC is not just providing in-clinic services, but providing services for people out in the community where they're at. This is just a quick FYI in case people aren't aware. Our locations for those clinics in Josephine County is Hillside Center, where we do largely adult and psychiatry services, Creekside for children and families, the Illinois Valley Center, which is the old Siskiyou building in Illinois Valley. And then in last year, 2020, I believe it was, we picked, is that right? Yeah. We picked up Choices Counseling that does alcohol and drug counseling because they were connected with Primary Health Coordinated Care Organization, which did not get a subsequent, their next grant, their funding approved for the next grant cycle for coordinated care organizations. And so then Choice was kind of left there with no home and really no backbone structure. And since so many of our folks also have co-occurring disorders, we've worked with Choices over the years on shared grants and projects like that. We picked that program up as well, and that's still there at Manzanita. One of the things I'd like to mention about these clinics is that they all are open for what's called non-traditional hours. So if people are working or have childcare issues or other challenges, there's times when they can be seen for services. All these clinics offer in-person and telehealth services. And also there are services offered in the community to clients who are in care with us beyond the hours identified at these clinics. But this is when the clinics are open. In terms of funding, most of our services are funded through the Oregon Health Plan, so Medicaid services. We contract here in Josephine County largely with All Care CCO. Some of the folks we work with are on Jackson Care Connect. In Jackson County, it's both of those CCOs that we work with. But we do also work with folks who don't have insurance, the various forms of veterans insurance and private insurance. We struggle with some of those other insurance plans because they do not pay for a lot of the services that we offer. They're very limited in terms of what they will pay for. The veterans insurance, Medicare, private insurance are very limited. Staff need to be licensed. For some of the federal insurance, it can only be a licensed clinical social worker or a psychiatrist or a nurse practitioner. So they don't pay for many of the services that someone might need. So how do people get options for Southern Oregon services? There's lots of different ways that people come to us. Self-referrals, that was one of the things that was noted earlier, and that could be by phone or walk-in. Get lots of community member and family referrals. Doctor's referrals, school referrals. So we have staff co-located in all the schools in Josephine County and in Grants Pass, and that staff may identify people, frequently teachers or administrators or students, and students often even self-refer themselves to the staff that we have in the schools, and we'll reach out to them and their families. Our crisis response team will start to bring people into care. They'll do after-care visits with people, and we do frequent, we'll actually do regular for everyone we see in crisis, either in the community or in the hospital emergency room, because we're on call 24/7 there, we will reach out to those folks even after the event for multiple times to try to make sure they're connected to a provider. Course requests through Three Rivers. Just looking forward in my notes. Okay. Requests through Three Rivers Hospital, child welfare. We have staff embedded in child welfare as well. Coordinated care organizations, those types of things. There's a number, so we're embedded in a large number of programs and services in the community, not just child welfare, but we have staff co-located at corrections. We have staff in the jail, the schools, the Head Start programs in the community, a number of the private medical clinics in the community, child welfare, as I noted a number of times, juvenile justice. So a lot of the places where there's kind of institutions where that serve certain populations where we can quickly identify that they might need the help and get them into services. So the largest way that people do come to services through us is what's called open access. And this probably started, how long ago was that, Shelley? It's been 5 years or so? 2012. 2012, it's been that long, okay. In 2012, and I'm asking Shelley because she's really, as our chief operations person and a nurse and someone who's very committed to the mental health needs in this community, she has really spearheaded a number of the I would say innovative ways that we provide services in this community that really enable us to engage people more readily, and open access is one of those. So open access is available at all our mental health clinics on the same day walk-in. All people need to do is walk in. We have because we operate in both Josephine and Jackson County, we have a coordinated system of assessments through those two counties, both in person and through telehealth. So we actually have someone who coordinates all those clinicians who are scheduled to be doing these open access appointments with people. So they can walk in, get their assessment. And assessment in mental health services, it's not like an assessment at the medical doctor. I mean, it's an hour and a half. So you're talking about a lot of master's level staff time to be available to do these, which is one of the reasons why we have somebody who coordinates this. And in an area that's traditionally identified as having low mental health and physical health providers, particularly mental health, we're federally designated as a shortage area for mental health staff. Being able to use your staff as effectively as you can is really important. So we moved to this open access model, both so we could reach more people and more efficiently use folks. And they're seen that day and scheduled for their next treatment session when they leave. And each month, as I've noted here, in this county alone, we have 170 new people walk in requesting services from us, who we assess. And that's just in this county for mental health. And then for substance use disorders, we have about 50 folks. Through the course of a year, we serve about 6,000 children, adults, and families in this county. So if you just think about the 170 people coming in each month, think about the number of people that you need, not just therapists, but case managers, skills trainers, psychiatry, nurse practitioners, medical assistants, peer support specialists that you need to meet the needs of all those folks. And I had talked about this a little bit earlier. So we partner with all these organizations and more, many of which we have staff who work directly with them. And I've talked about child welfare. We have people in DHS self-sufficiency offices. We have someone with UCAN. a peer person who works with them around housing. Looking at some of these other places, we're involved in all the specialty courts, the alcohol, the drug court, the mental health treatment court, the recovery court, the recovery court for folks that don't fit within the criteria of the drug court and the mental health court. We work closely with the Grants Pass Police Department, both on mobile response and their, what is that? The crisis intervention negotiation team for those more kind of high-risk police situations. We've done drive-alongs with them to populations where they've identified people who may need to be able to get into mental health services. So there's a lot when we look into the future. One of the things that I wanted to mention here for this council that we are working on with some of our partner, or a lot of our partner organizations actually, and we're just starting this, is through Measure 110, which is the one, and Chief's very familiar with this, but some of the decriminalization around drug use. A piece of that is the development in each county of these behavioral health resource networks, which are really designed to better coordinate services that are already available and to identify what types of services within the scope of what the advisory council at the state level has identified as being necessary, what we see as needing and how we're going to develop those services. And this is really focused on the traditionally underserved populations. So a lot of it is, the BIPOC population, folks who are indigenous, Black, other people of color, and also the LGBTQ community as well. So people who traditionally have been underserved or may have been, what's the word I would use, not some of the more traditional routes that we have gone through in the past to address alcohol and drug abuse have been detrimental or more significantly to those certain populations perhaps than the general community. So there's a couple things, I'm almost done, I'm probably way over my time. If I had to mention opportunities, one of the things that's, I think, really great that we see now that I try to remind myself of is I think there's a greater awareness than ever before of the prevalence of mental health concerns in communities across the U.S. There's a bigger understanding of the importance for people to feel well from a mental health perspective, and there's an increased emphasis on treatment for people, which is really great because it's been many, many years that we've been fighting just to kind of have mental health even recognized as something that's important for folks. If I had to talk about challenges, workforce is huge. It's just huge. The way our systems are set up in terms of mental health services, we can't do anything without licensed masters clinicians. They kind of drive the boat, and so does psychiatry, psychiatrists or nurse practitioners. And we cannot recruit enough of these individuals. We've tried, I think, practically everything there is. There isn't, if you go on our website, there's not a position, it doesn't matter if it's support staff, that's not getting a recruitment bonus, retention bonus, paying for people to move here, paying for continuing education, giving people supervision for licensure, trying to do everything we can to recruit and bring people to the area. But we struggle with the same thing you folks are familiar with, and our clients struggle with housing, even getting anywhere for someone to live, who moves here from out of area, getting reciprocity around their license from another state perhaps to here. We each year probably pick up half of the SOU interns that are available, and we pay them, to come and do their internships with us, and they get jobs and offers in their hand 3 or 4 months before they're even finished with their school. And we work with PSU as well and some other schools to get students. Some of the things we struggle with our clients, housing. I mean, housing is just huge. It's if you don't have a place to live, you can't even think about how you're struggling with your mental health. And they're so interconnected. The living wage jobs, childcare is still a big issue for both our staff and folks who want to come into services. So all the things you folks are familiar with. So, okay, that's it. I'm sure there may be some questions, maybe lots of questions. So.
Thank you. Council, what questions do you have? Joel?
Well, I think I know the answer from your presentation, but I just want to make it clear. Given we're designated an underserved area for mental health and addiction services, maybe it's just mental health services, I don't know. Given that it's hard to recruit professionals that can be credentialed, much less the ones that are not credentialed by insurance companies, that can serve the needs. Given that it's difficult to retain those that you have, because it has a high burnout rate in terms of the profession, I added that, you didn't say that. Are you adequately staffed now, and do you foresee that occurring over the next 2 or 3 years?
We aren't adequately staffed. We haven't been for a while. It's very interesting because we're at a point in time where, as I was saying, the need for mental health is more recognized than ever before, that there's funding starting to loosen up around some areas, but we can't get enough people to do the work. And that's my concern even with the Behavioral Health Resource Network in terms of looking at applying for that. I have to realistically be able to do, we have to be able to do the work that we say we're going to do. And so it's a really weird place because, as organizations in the community, it doesn't matter whether you're public or, nonprofit, you're always fighting for that next dollar and seeing so much need. So it's an interesting spot to be in, yeah.
So the next question I'm kind of afraid to ask, but so if somebody successfully completes a program and there's no place to go to live,
Yes.
or if somebody doesn't successfully complete the program and there's no place to go to live, where do they go?
That is a challenge. It's a statewide problem, and as folks here know probably, there are state, committees and work groups working on all these issues, because it's not just us here in Grants Pass and Josephine. Everyone's having this problem. In fact, we're probably a little bit better suited, believe it or not, in Grants Pass and Josephine, because we just have a longer history of working on these issues than some places do, and consistently. Sometimes they sit in those treatment programs until we can find alternatives for them. Our staff do have a lot of good relationships with landlords who are willing to take our folks. We've done things like put down security deposits for people, covered apartments for a period of time if we're not sure somebody's going to make it, but we don't want to, and held on to their treatment spot back in the program. And we just work each individual cases as best we can. But I will tell you, there's times people are in crisis and they're released from wherever they are in the community, and they don't have a place to go to. We do have a crisis resolution center that we operate, where we do a lot of diversions from the local emergency room and hospital. So from acute care for psychiatric illness, we will take people out of the jail to stabilize them there. Sometimes we're able to use that as a stopgap measure, but there's only 15 beds there that are being used for a wide variety of different situations. But if somebody's got a place to live, we do everything we can to make sure they don't lose it, because there isn't a lot of alternatives. So, especially for the populations we work with. Yeah.
Other questions? Rick?
Thank you for your presentation. The open access program, is that statewide or just unique to Josephine County?
Well, it's unique to Josephine County. There may be other organizations that are doing it. I think there are other organizations that do it for a certain number of hours during the week. I think it's pretty unique that the whole time that you're open, that you're available for that service. Now, obviously, with that being said, if somebody comes in half an hour before we close, we're not going to be able to do that full assessment. We're not going to have the time. We really encourage people to get there as early as you can at the beginning of the day, so.
And then on the credentials that staff has to have, is that set at the federal level or state level, or?
It's set at the federal level because the state certifies us as a community mental health program. We are able to have, for example, therapists, master's level people who aren't licensed yet. And they work under us on their license, but there's additional supervision and administrative requirements to do that. One of the challenges, that we do have, like I think most mental health programs around the state, is that once people get licensed, there can be a tendency for them to want to go into private practice for themselves. They make more money, the population's not as challenging, the administrative burden in terms of working for a public entity is not as great, they have more freedom around what they're doing. And I don't want to paint everything bad. We have done, I believe, very, very well in this community in terms of the number of staff that we have and the wealth of services that we have: housing, residential treatment services, crisis services, outpatient services. But our need is so huge and growing, and the complexity of folks we're working with. I mean, we sometimes joke that, 18 years ago, we were doing mental health. Now it's like we jump up and down if somebody just comes in and they have a mental health issue, because usually there's co-occurring addiction issues and a lot of other stuff going on there as well. So, yeah, which is why we work with so many community partners, because there's just multiple needs.
So my last question, do you have different levels of certification? Like with the doctor's office, you can have a full doctor, a physician's assistant, and other nursing levels too. Do you have that opportunity, or is the licensing and degrees very restrictive?
The licensing and certification drives it, and it depends on the work that's being done. Yeah, so it's the same. It depends on the work that's being done, who can do that work. Yeah.
Thank you.
You have a lot of paraprofessionals.
Yes. Yeah. So as Shelley mentioned, yeah, we have a lot of, in fact, probably majority of our staff are paraprofessionals. So they're sort of bachelor's level-ish, but they have to work under a master's level person with so much experience. Yeah. Yeah.
Other questions? Valerie?
Yeah, you mentioned in the clinic that you have that people can walk in the open clinic. What percentage of those people are have addictions that they're going for, as opposed to just a mental health or other issue?
I don't know the actual percentage, but I can tell you it's very high. And we do assess for both at the same time. If somebody has an addictions and a mental health issue, we try not to separate them out. We try to treat the individual as a whole. So the primary driver, maybe they're there for a mental health reason, but maybe secondarily the addictions is actually driving some of it, or vice versa. So we really try to look at it as a whole, and we do look at the whole thing, the whole person at that moment.
So if there's one area, is there any particular area that you feel that we are the least able to help with?
I think some of the co-occurring, when somebody has both addictions and mental health, that can be very challenging. Getting somebody to, it's kind of like, what do you address first, and how do you look at it, and what's the best to help the person move forward in recovery and the next steps. So I really think the co-occurring is probably the most challenging.
The folks with the significant co-occurring issues?
Yeah.
Yeah. Yeah.
I can't thank you enough for what you do. Like I said, I know it's out there. We see it, and I appreciate it. I worked in the schools, and I saw what you did with students and families, and I think that was very valuable. I just have a question. Southern Oregon Adolescent Treatment Center out in Merlin, was that ever a part of options, or how did, I know at one point in time that was the county I think it was a county program, wasn't it?
Yeah, it's part of Kairos. It was part of what's called Kairos now. Yeah, so it wasn't part of options.
Okay.
Yeah, the Southern Oregon, there's two with similar names, but the one that you mentioned was rebranded, Kairos a number of years ago. That's not there anymore, the one that's in Merlin, but.
It's still there, it's just not utilized.
Oh, it's still there?
It's there, but it's not
Building.
used.
It's
So
not
the
used, yeah,
building
the
is
building's
there,
there,
but
yeah.
it's, I think at one point they were renting it out for school for airport, and I'm just,
Okay.
I know it's there. And Kairos, I also understand that Kairos kind of went away or has had issues, is that correct, or, I mean, because it,
They're still here. They actually have an outpatient program in Jackson County. They had residential programs here in Josephine that recently closed.
okay.
They still have some residential here though, don't they, or no? They have the
They
one,
do. They have a on-secure for 17 to 21, and I'm blanking, Momentum. It's a fantastic program, yeah, for the young, older, like late teens, early 20s, that really helps kind of move people forward in
Yeah.
the next steps.
And that's a private, am I correct? Or is
private
that also?
nonprofit, yeah.
Okay.
Yeah,
Right.
and I think, the closing of the program that Shelley had mentioned just draws attention to the fact that it's very interesting in terms of the funding, the way the structure works, because, as I said, in terms of the same with Kairos, the majority of services are funded through the Oregon Health Plan. It's similar to medical insurance. So I think people frequently think about mental health as you get this big pot of money to do whatever you want. We have to bill just like you do in the medical arena. So you have to meet certain criteria. There's certain things you can bill for. There's certain things that you can't. And a lot of our services, in order really to maintain strong infrastructure for mental health services, you need capacity money. You need to have the money to pay for everyone you need, regardless of whether you've got 10 people coming in the door that day or 50. They all need to be there because some days, you'll have 10, some days you'll have 50. We've been fortunate in terms of our work with All Care that they recognize that and will fund to help us maintain capacity, but some of our other funding isn't, it's not set up that way, so, yeah.
Speaking of the funding, do you expect more money to come back down as a result of 110? I know that they kind of pushed it through without working on the funding part of it, so is there more funding in the future?
Well, the behavioral health resort networks, the funding comes out of 110. And there's, you need to identify who you're serving and how many of those, and then there'll be the reporting and tracking. So it's the similar process. So yes, there will be some funding coming out of that. We'll see how much that is. Yeah.
Joel?
I had two quick questions. We had our own little clinic, and you folks were great partners and did a good job. We had several patients that were addicted to opiates, painkillers, hydrocodone, and since they couldn't get that for whatever reason, they turned over to heroin, and then had to go down to Medford for treatment.
Yeah, for residential treatment?
No, I think it was outpatient treatment. It was a pain clinic, or I'm not quite sure because I just did the referral.
Okay.
I don't understand those things. But anyway, he had to, because the services were not available here in Grants Pass.
Okay.
Are they available here in Grants Pass?
They are available in Grants Pass. I mean, Choices, which we operate, and On Track and Adapt all do outpatient services for people with substance use disorder. I don't know what kind of insurance the person was on, so can be another challenge. And I also don't know what level of treatment the person needed. So sometimes it depends on the treatment level where the person
There is a
needs
clinic
to
here
be.
in Grants Pass, if you're talking like the methadone clinic and the Suboxone.
Okay.
There
It
is a
might have been
And
medicated
that's
assisted
relatively
treatment.
new then, correct?
Yes.
Yeah, it's been a couple of years, and we also do a little bit of that through our
Cool.
primary care also.
Cool. Okay, then my next question was, and I kind of hate to ask it as well, what is the results of mental illness and addiction that are not treated or that are treated unsuccessfully? What are the consequences to the community and to the individual?
Well, yeah, I think some of
That's a
it we're
lot.
seeing.
Yeah.
Some of it we're seeing, although I will say, you know, there's a lot of chicken and the egg when it comes particularly with the homeless population. There are a lot of people who are just living on the edge anyway, in terms of their income level, in terms of their ability to afford housing, childcare, the whole rest of it. And quite frankly, if they don't have a drug addiction issue or mental health by the time they lose their housing, chances are they're going to develop that being out there. So being on the streets, living on the streets where that's a lot of your community, nobody feels safe, comfortable, secure. It has a huge impact on your mental health. There's a lot of, as everybody knows, drug use and drug communities in folks who are homeless in the general population. So that's why I say there's some chicken and egg. Untreated mental health and drug use can lead to homelessness, but so can insufficient income and lack of housing can lead to homelessness, and then subsequently mental health and drug issues. So it's really, there's a lot of overlap. In addition to, you know, domestic violence and low educational attainment and lots of other criteria.
So you definitely see more, we see more folks at the hospitals, the police department sees more folks. You know, it impacts everything pretty greatly. That's why we tried to develop resources like our crisis response, our crisis team that can go out mobily and try to meet people where they're at. We've done a lot of outreach trying to figure out how to get people and connect into services, but ultimately it's a choice. So.
Thank you.
And it's not politically popular, I probably shouldn't say because I'm being televised, but many of us in the treatment arena do see a place for the various places, the various resources through the courts and other places to help kind of get people where they're going. I think we do need to do more work to move away from that, but there's a lot of pieces that need to be in place, and prevention, which Sean will talk about, is a huge one of those. I mean, keeping people from getting addicted to begin with is really our only way out of this. There's that whole saying about somebody at the bottom of the river, right? Watching all the babies floating by and trying to pull the babies out of the river, babies out of the river, babies out of the river. And somebody else finally walks up and says, why don't we go upriver and see who's throwing them in? Well, that's what addictions and mental health is. We don't invest in prevention. And that's the only thing that's going to get us out of this picture. We address after people get sick. After people get broken, that's when we start to put money into the situation. And it's way more expensive, and it's way harder then. So that's just a, comment.
Brian?
Okay.
Yeah, thank you, Carla and Shelley, for being here.
Thank you.
One of the questions that is going through my mind is, City Council is kind of separated from what we're talking about today. We don't have a Department of Public Health or things like that. But one of the things that we are talking about doing is working with partners to establish an urban campground here locally. Mm-hmm. And I'm not sure how familiar you are with that, but it would be modeled after the one in Medford that Road Retreat runs. And I was just wondering if you can speak to the effects that might have on our community, the benefits or the deficits, or just how that, how that would affect options.
I don't want to hazard a guess of what it would do to our community, but I can tell you that we do a lot of work at the Urban Campground in Medford. We actually have staff that go there and really work on engagement and getting people into services and treatment that's needed. The really nice thing about that team is it's through our CCBHC program where they can really work, and if it takes 10 times to engage somebody, they can put that 10 times in. And it's really great because it really meets the person where they're at, not only physically location-wise, but it works to start building the little seed even of how we can help you. So in a way, it's actually, I think, very helpful to get people in, once you get them into housing and they have that worry taken away, or into even at the Urban Campground, if they're there and that, you know, they're not worried about where they're sleeping that night, it gives them and lets them open up more to getting into treatment. Because when you're trying to figure out where you're going to sleep, your next meal, all of that, it's really hard to figure out how to take your meds, how to, you know, meet your physical and mental health needs.
Thank you.
Let's have Sean Martinez speak, and I assume are you ladies able to stick around for a little bit if there are any additional questions? Thank you.
Thank you.
All right.
Close my cell phone.
Yeah, I was just going to pull this up for her. Ready to go.
Thank you. All right, good afternoon. Sean Martinez, Prevention and Treatment Services Manager, and I am housed under Juvenile Justice. And representing the county in our prevention and treatment services. The county funding for treatment goes to Adapt, On Track, Options for Southern Oregon, and Choices Counseling. We also provide some funding for our Grants Pass Sobering Center. We're pretty unique in Josephine County. I feel that our treatment providers all work so well together. When there's an application for funding, all the providers come together to look at the strengths that each partner has, and we're able to facilitate the funding between the partners. The funding that's available is, the majority of it is for those clients that do not have insurance or they're underinsured. So that's outpatient treatment. And then when we have our inpatient treatment, some of the housing cost is for those that are on Medicaid. So there's two different service elements there, 61 and 67, based on client service days. And right now our inpatient treatment is Options for Southern Oregon, On Track, and Adapt. But Adapt's treatment facility is in Roseburg. We also provide funding for problem gambling treatment, and this is free treatment to anybody that seeks it, not only for the person with the issue, but family members of that as well. And then we offer services for peer-delivered services, which is really helping support someone that's chosen to take the path into recovery and providing them their what are emotional, any kind of barrier removal to get them. Sometimes it's walking them from one place to the next, transporting them, services that are needed, not necessarily housing, but food, clothing, engaging with employment, however we can help, or the providers can help. The treatment services are all contracted out, and the providers meet to look at how things are going, and we adjust based on the funding needs. Meaning, if one provider is seeing more services in outpatient, or they're providing more of the outpatient and the other provider's not, we can adjust that funding between the providers. And same with the outpatient services. Right now, Options is the one providing the problem gambling treatment services, and then peer-delivered services is Choices and Adapt. And then our county prevention department, which is housed under juvenile justice, is myself and 4 staff. We have prevention services that we contract out with Boys and Girls Club, and they provide prevention education curriculum to all 6th graders across the county, both Three Rivers and Grants Pass school districts. And then Family Connections and At the Well provide parent education, strengthening families throughout the county as well. We have our prevention outreach coordinator, which works on tobacco policy. They are the ones responsible for all the state requirements with our tobacco funding that comes in. And they also work on problem gambling prevention, Sometimes that's the media piece of it, or just outreach to people to help support them and guide them into treatment. And then we have our school outreach officers. And this really has been a pilot project. We're on year 3, and it has been very successful. More successful in Three Rivers because we have 3 staff that can cover those schools, and we only have 1 staff in Grants Pass High School. And those staff work with and help support each school. They're actually part of the admin team in most of the schools. And they are helping with attendance, graduation rates, barrier removal. They do home visits, truancy issues, the whole gamut that's listed up here. And the bridge between juvenile justice is the youth that are cited for any kind of substance use, whether it be the MIPs, and for marijuana or vaping or alcohol. They're cited into the juvenile justice office, and then they go through that process. And whereas a lot of the schools, the youth may be caught with, let's say, vaping, and they're not cited, they stay within the school. So we've put a system in place that when they're in the school, they're still gonna go through a process of education, a screening, and support with the goal of keeping them out of the juvenile justice system. The homeless support for the youth is removing all barriers to get them to school. It can be a variety of different things. It can be finding clothing. It can be bringing their lunches to them, their Chromebooks, delivering the prevention curriculum within the school or one-on-one outside of the school. And so while everybody was out of school last year, the outreach officers were actually more engaged in supporting the schools, doing the home visits, delivering the packets, the Chromebooks, mentoring kids struggling, keeping them engaged. A lot of the time, if the school maybe lost track, that's not the right word, if the school wasn't able to engage a student, the outreach officer could go out, find that student, and help engage them. And there was a lot of moving around. The Illinois Valley, our outreach officer out there, is a huge integrated part of their school system. And we had Principal Smith had just said in a meeting last week that he doesn't really know what the job description of the outreach offices are. He just knows that they are an integrated part of the school and it would be hard to go on without them. Some of our opportunities for improvement, District 7, again, with the kids being out of school for a whole year and then coming back in, trying to create that balance and support for the schools. We've seen a 200% increase in vaping from the 1920 school year to the current. And we're only 2 months into the school year. Increase in marijuana incidents, 39 so far this year. I'm sorry, in the 1920 school year, only 16 in the previous in the first 2 months, sorry. The truancy issues, and truancy is students that are at risk of dropping out. The chronically absent are those students that are not at school 90% or more of the time. And then the dropout rates right now have doubled since the 1920 school year. And so I think what we are looking at right now is really building more capacity and resource to have the outreach officers available to the schools and helping support them and increase the prevention and intervention strategies that are happening. There's a lot of, again, moving parts to it. It's never the same, and it really is geared to those youth that are struggling or have barriers. And not just the youth, but the family as a whole. How do we engage the whole family? And they have been very successful in getting kids back into school, engaged, graduated. And we're just seeing this influx of lack of education around vaping. And so that's one of the things that we're working on is some, not only vaping education for across middle and high schools, but for the parents as well. And that's it. That's our program.
Thank you. Council, do you have questions? Valerie?
Yes, can you explain the ADAPT program? I'm not familiar with ADAPT. What exactly is that particular program?
Adapt is a treatment agency. So they do outpatient, inpatient, and they're in Douglas, Josephine, and Coos counties, and a little bit of Lane.
Joel?
So just a quick observation and then the questions, and they would be for all three of you. I don't know if you want to do that now or you want to wait and just honor this speaker with questions for her. I'll leave that to your discretion.
Yeah, I think we should start with questions for her.
With her?
Do you have a question for her?
Well, it would actually apply to all three. Is that okay? Okay.
Go ahead.
Okay. One of the things I've heard from all of our speakers is that the need is increasing and the resources are limited and inadequate. I'm not sure those are the correct words. That was just my feedback of what I thought I heard. So I had 3 questions. And you can choose whichever question you think is the most appropriate, or if it's not, you can answer the question that's more appropriate, okay? What opportunities are available to increase services? How can the city help? Grants, collaboration, get out of the way, or whatever? And what do we need to learn to be more effective as a community and county in treating mental health and addictive services? Some of you touched on some opportunities. I would just like to directly ask that question.
I would say grants would be great.
Is that microphone on? Is your mic on?
I think so. I didn't touch anything.
Okay, maybe could you stand a little
Okay.
closer? Thank you.
Sorry. So I think that grants, funding, support, aligning with some of our prevention strategies, tobacco policy.
I think one of the things that I would mention is I think a lot of it's the kind of thing that the council's already working on, because it's making sure we're expanding the way we're looking at this, that it's not just about providing treatment. There's reasons why people are getting here. And a lot of those reasons why people are winding up where they are things that the council's already working on. You know, the housing issues, for example, they're huge issues. And they're huge issues everywhere. And they seem, some of these things, the housing and the drug use and stuff seem to even be more prominent in this part of the country, you know, from California, Washington, and Oregon. And so it's kind of taking a look at those pieces. To me, I mean, if we could, we shouldn't be spending the amount of money that we're spending on these kinds of things. There's other things that are leading there. So I guess I would just encourage a lot of these areas that the council's already looking at to not give up, to keep pushing, even though it's difficult, because it's going to help the rest of the system and it's going to help the community. And you guys know that, but just as a reminder. So, I mean, we talk about social determinants of health that people know. It's the majority of things that impact our health are things that we can control. You know, they're not genetic. So,
Thank you. Doctor, do you have anything to add to that?
Hi, David Candelaria. I think money is the easy answer, but really it's going to be ideally a coordinated, multi-pronged effort, ideally aimed at prevention, and that's just a big project. It's easier, it seems, and historically what has happened is, you know, reactive medicine, a reaction to the problem at hand. And we've got plenty of problem at hand to settle before I think people can even say, so now where are the resources that we can turn toward the prevention aspect? So I think getting people sheltered, attending to more proximate or immediate social determinants of health, food, shelter, health care, mental health care. That Band-Aid, once that Band-Aid is in place and sustainable, then lift your eyes up and say, so how can we prevent people from ending up here? Those are my thoughts.
Thank you. Brian?
Yeah, thanks, Sean. I had a couple questions. The first one's fairly specific. You mentioned that there's a program for sixth graders that's run through the Boys and Girls Club that revolves around prevention, and I was just wondering could you provide any more details about what that is?
Yeah, that is Smart Moves curriculum. It's a several weeks, well, actually it's individualized per school. So it could be a week-long curriculum that's done. It could be over 6 weeks. And Boys and Girls Club staff go into the school, into the classrooms, and present the curriculum over the 6 weeks. Or 6 sessions, I should say. Again, it's flexible on the school and their scheduling.
Okay.
And that goes to all 6th graders.
That's great. Yeah, I think that is a huge, that's a key time to work on prevention, is getting into middle school. And I had another question. On your last slide, it talked about the opportunities for improvement, and you specifically called out some statistics at District 7. And without getting into the statistics, basically what you're saying is more capacity and resources are needed at District 7. And it sounded like you just have one individual working in the high school and the middle schools and Gladiola School, is that right?
Yeah. Yeah, she's spread very thin, and so we have to really pick and choose. She cannot provide the same services that we're providing out at Three Rivers, because each one of those outreach officers have a high school and the middle school attached, and sometime are able to get to the elementary depending on the siblings within that structure. So, sorry I cut you off.
Oh, no, that's okay. I'm also on the Grants Pass School Board, so I would, if the administration and the board is not aware that more resources are needed in the district, I would definitely bring it to our attention and we can address that.
All right,
Thank you.
Other questions? Valerie?
Yeah, I just have a question, because I know, having been an elementary school teacher, how important it is to have family counseling and families. So do you offer family counseling with the children that are having issues through the schools? How does that work?
Well, we don't necessarily have counseling because that requires certification stuff. But what our outreach officers do, if there is a student that maybe isn't engaged in school, or they're having behavioral issues at school, and the school asks for outreach officers to give some guidance, they will go out and meet with the families. They'll go out and meet with the parents, look at like what are the barriers to getting the kids to school, or can we support them so that they're going to have passing grades. And so then it may be a referral out to behavioral health, it may be a referral for substance use, but that is part of looking at the family as well. Because just because a student's not coming doesn't necessarily mean it's nobody else's problem but the students.
So do you find that there are, that sometimes the parents are the barriers? And what do you do in those instances?
Yeah, I think I would say yes. And I would say that you just keep trying to support that student and the parents in a variety of different ways. Maybe it's the parent is not providing adequate food or clothing, then you're going to support getting that clothing and that food, but you're going to do it in a way that's not threatening to the adult. And then you engage and build that relationship with the adults that then better help support getting them into whatever area of help they need.
Joel?
I just have one last question. The in-house addiction services, and I can't remember which nonprofit did that. Was that Options or?
On Track.
On Track, okay.
Options.
What is their capacity and what is their occupancy?
Well, with the funding that comes into the county, we have funding for 11 beds.
11 beds.
11 beds is how we break out the funding. So of course that is not enough need. However, that's not the capacity that each provider has. That's what we're able to fund to them for those people that are not insured, which doesn't always get all utilized because a lot of people then go into Oregon Health Plan and then the funding is covered elsewhere.
Sure. So the occupancy on those 11 beds, I would assume, is 100%?
Yeah.
Okay.
Yeah, they exceed their funding every year.
And if there's a need for additional beds, it just goes unmet, is that correct?
Well, if there's a needs for, with this particular funding stream, if there is a greater need, then I ask for approval from the state to either move other funding that's not being used around.
Sure.
And so right now, On Track has the biggest capacity for residential in Josephine County, and I believe they're asking for approval for a larger bed availability.
Okay, thank you.
Yeah.
Any other questions for Rick, for Sean or anybody else, I guess at this point? Rick?
So on the, you said you have the need for additional beds. Do you have an approximate bed cost? What it is per bed? Because that's based on a nightly.
Yeah, so the funding that, again, that the county provides is, the nightly rate is, Shelley, do you have it? I don't know what it is. Like $157 or $162 per client service day. And then the actual providing the treatment is only $24 per client service day. So, again, this is for the underinsured or not insured.
Joel?
So this is probably the most important question from my standpoint, and if there's one more important out there that you think was left unasked, you can answer that because you live it every day. How do we increase funding to increase access to mental health and addictive treatment services regardless of a person's income? How do we increase the funding to increase access of people in the county and city to mental health resources and addiction resources regardless of their income?
Well, if there's problem gambling issues, that's fully funded. It would be nice if all of our treatment funding could fall in that same line, but I'll let you answer it.
Oh, I don't have an answer to
Okay.
that one. That's a very good question. But I do know it is one that the Oregon Health Authority is looking at regularly in terms of how that's done. I don't have an answer for that. I do want to note one thing, though, for consideration in terms of where we are now, is we are still in this, technically pandemic period. And even we were struggling, across the state in the U.S. with mental health and addiction issues prior to COVID. And then, of course, we have all the additional challenges that brought on in terms of isolation and fear and anxiety and such. But many of our residential treatment programs, particularly substance use, but I know even across the state mental health, they needed to decrease their numbers over the last 18 months for social distancing, and also because of the potential spread of the virus outbreaks in which we have to take certain steps. And so that is a piece of the picture that I think is exasperated where we are now. People that even though we haven't had adequate capacity, particularly substance use disorder, but also mental health. For residential, it was exacerbated during COVID because numbers in the programs were decreased for health and safety reasons. So now we've kind of got this backlog as well, if that makes sense. So,
Yeah, and each of the treatment agencies have a sliding fee scale. And even with that, I have been in my position for 13 years, and I've never heard of anyone being turned away because there was a need. And so, so I think that in addition to that is, there is some funding that's come down from the state to really work on the workforce in the addictions field, because I think that's where we're short as well with counselors.
Any other questions? All right, everybody, thank you for your time today and answering all our questions. Council, did you want to have any further discussion on this today?
Well, I myself need a little bit of time to digest it. In terms of the city's role, and it's not operating expenses, it's not personnel, it's infrastructure and programs. I did hear some good suggestions I think we need to follow up on, but what I'd like to do is let it settle around in my brain for about 3 weeks or so, and then come back as a discussion on a Monday to discuss our options and what those are. It's kind of a sobering subject. It really is. It's almost, or the word that comes to mind, overwhelming, that really needs some attention.
Valerie?
Yeah, I'm just going to say thanks for coming in, because you've done a good job of kind of letting me know the ins and outs and how it all kind of comes together. And, you know, having been a school teacher in the public school system, the need was there then, and so I know how important and what you do, how important it is in the community and how much you do. And so, you know, I can't thank you enough for that, but I also recognize that the need is in a lot of ways only going to get worse. But I am encouraged that there is an awareness, as you have said, that wasn't there before, and much more of an acceptance to discuss it and talk about it and be more open to it. And I think that's huge. Personally, from a point of view of children, just to be able to talk about it and realize that this is real. I mean, it's real for all of us. So that I'm encouraged by. So I look forward to trying to help solve the problem. I don't think it's as easy, because a lot of it just comes down to getting the people and the funding to pay them, people who are qualified. So, and I know it's a high burnout.
Any further discussion today? All right, thank you to all our guests, and you're welcome to stick around or leave. We won't be offended either way. Our next item of discussion is to talk about the Urban Campground. And as you all know, last week, I don't think we have any sort of presentation, do we? We're just discussing. Okay, so as you know, last week we received notice from All Care Foundation that they had stopped, I guess, their purchase of the in-street property. I also did not sign off on the grant that you all had approved the previous week, so we will need to start over on that process. That, you know, is kind of a moot point maybe anyway, but that grant was, I felt, a little messy in terms of the language and the way that we were going about it. So I do fully support the idea of giving a grant, but just the particular details of that plan weren't working out for us. So I know that I spoke with Doug Walker, and I think maybe some of you have spoken with different members of the All Care Foundation as well. I think they are still interested in working with us on this issue. We just need to regroup and go about it a little bit differently. So we don't have anything we need to talk about today. We just wanted to give everyone an opportunity to kind of catch up on where things are at, and if you have anything to add or, new direction, that would be great. Rick?
I received a memo, we all did, from All Care, indicating their current position of withdrawal of the initial offer on the property, and then also asking, I interpreted direction from the city council as to what they should be looking for, and I didn't know if it was appropriate to have a discussion, some of the parameters, and I'm not sure what our ability or authority is to set parameters, like can we say, you need to be a half a mile or a mile away from a school, or a quarter mile away from daycare, and that type of thing, just to, I would say, avoid controversy and some of the problems we've gone through with the latest request. I'm just throwing that out there. I didn't know if that would help them.
Certainly might help them choose. I mean, I think that the way this is set up, All Care is buying a property. The city council is not buying a property. However, it is using funds that are being passed through the city, and we need to have the council's comfort level with whatever property is chosen. So I think if the council wanted to draw some hard rules like that, or some suggested direction, you could. I think likewise with the grant, maybe outlining what our expectations are in kind of a more general way would be my personal recommendation. Maybe that you expect that the property will be run as a campground for 5 years, 10 years, 20 years, I don't know, but rather than getting into like nitty gritty of approving, a particular property and the bill of sale and all that, but just, what terms do you expect for your money, and under what circumstances would you, want to consider perhaps getting the property back, if any, or things like that. Joel?
This learning is a very powerful tool, and everything is just a learning event. There is no such thing as failure. So what did I learn from this last process with the Urban Campground proposed location? I wrote back to Jed, and this is what I said to him. We need a community consensus, not surprises, an open process with public support, similar to what we did with Foundry Village. Foundry Village was very successful. And it was, there were no surprises there. This time around, there was no preliminary debate. There were closed conversations that were one-on-one. That was outside the public venue. There was no consensus, and there was no public involvement plan to be proactive. And so what we have is, on one side, I don't know if this is going to be effective or not, but on one side we got people saying we need to show compassion, and on the other side we have people saying we need our parks back. And so they feel like they're not heard. So this side says, we need more compassion. We need to get our parks back. We need more compassion. We need to get our parks back. Nobody's listening. There's no community consensus. And then these folks say, we're going behind closed doors and solve this. We're going to exclude you. Well, I'm going to say an inappropriate word. Nuts to you. Okay? We're going to do it this way. And what happens is it sets All Care up for failure. And we might be able to, so instead of that, instead of everybody repeating both things which were true, both sides had truth. We need to show compassion, and we need to get our parks back. So that we have this consensus, and we do it in an open process. It's not a zero-sum game where one side wins and the other side loses. We all win or we all lose. And I've never known a closed process to do that. To be respectful to All Care, if we do surprise people, what's going to happen is it's going to boomerang back on us next year, and it won't be solved. You'll still have the same two groups yelling at each other. Only this time it'll escalate and it'll get larger. And it won't be resolved, and it'll take all the energy of the community
to the detriment of everybody. So I would like to see our process have an effective public involvement plan that is proactive, that is based on truth. I would like to see the people listen to each other and understand that there are a lot of different valid concerns associated with it, and we don't just address one and ignore the other. And I always believe Guilford Pinchot with the U.S. Forest Service and Teddy Roosevelt talked about always having an open, honest, and professional process. And if you don't have that, you can't do anything until the public really supports you, because it'll be undone.
Valerie?
Yeah, I agree that, but I will also say that in a lot of the emails that we did receive, I did hear that compassionate part that said, we don't disagree with the idea, we just don't like this particular location. So I was encouraged. I was encouraged with people saying, we do have compassion and we do recognize this is a problem. I think we have to be very open and honest and say this is not going to solve the park problem. We know that. But there's a lot of things that can come about as a result of this that may lead us to a different spot, and I think that's important too. So I think we do need to have a community conversation, and I would agree with you, which is why I insisted in the first place that you have to do it in open. And so the biggest issue that I see is the location. I mean, what I heard everybody giving ideas of, well, you should just do it this place, or you should do it that place. And what the community needs to understand is we can't choose if somebody's not willing to sell. And, you know, we could find a lot of great places for it, but if the person who has that land is not willing to sell, it's not going to happen. So we really, as a community, need to reach out and find people who are willing to offer up property to sell or lease or whatever to give us a place that it could happen. And so, you know, that's where I feel, in a sense, you know, All Care unfortunately failed, because that was the only one that we knew was at that point willing to sell, and so they just jumped on it without giving it the whole process. So I'm not exactly sure where to start, other than to say I know the need is there, I know that people want it, I can say I feel that they recognize it. I wish the Courier would have first ran the article on the wonderful Rogue Retreat before they wrote the article of what was happening, because Rogue Retreat just does a phenomenal job. And I think there was an article in the Courier. They did an excellent job of telling what they've done. There was another article this morning, actually, in the Medford Tribune talking about, you know, how Rogue Retreat has been able to keep people working there when a lot of other organizations have not, because people really are compassionate about trying to help people, and they can see the success rate, and they can see how they're doing positive things and helping people get their life back. So there's just a lot of really positive things that can happen in this. It's just in how it's set up, and if people were to go out and see how Rogue Retreat has set things and see their success rate, they would feel a lot better about it. So I agree with you, Joel. We need to somehow come to a, you know, I personally think, even as counselors, if we met with the All Care Foundation and just had a discussion with them, even if it was a few of us, that would be a place to start. And then, like you said, go through the public process part of it afterwards. So I can see a process with that. And also, like I said, putting a call out. Who has property, or who's willing to knock on the doors of some place where they think that's a great place to have it, and ask them, are you willing to sell?
Brian?
So I think first I want to start by apologizing publicly to All Care for how we handled the situation in that business meeting. Regardless of what anyone thinks of the particular location that was being proposed, staff took it upon themselves, without consideration from All Care or council, to disclose that location, which I feel was not appropriate. So I'd like to, and that was really the fuse that set off the entire bomb that has been this negative pushback campaign. So I just wanted to start with that. And I appreciate that All Care is still willing to work with us after all this has happened, because I could very easily see them not wanting to work with us after that whole debacle. So I'm glad that they're willing to work with us still. I do think there is a majority of the community that understands that this is going to help our community. I also think that no matter where it is, whoever's close to it is not going to be in favor of it, and there's always going to be some pushback no matter the location. So all that said, I think moving forward, probably a good way to proceed would be to come together with All Care staff and All Care and maybe, 2 or 3 counselors, and kind of work out some of those initial details that we want to see in a contract. Not necessarily associated with a particular location yet, but just kind of like the parameters that the city will be comfortable with, the parameters that All Care will be comfortable with, and not finalized, but kind of, get it hashed out so it's a workable document that both parties feel pretty comfortable with. I think so far it's been council up here on the dais kind of, deciding what it needs to be, and All Care just kind of like flailing in the wind at our whim. And I don't think that's the way to handle this. I think we need to come together with All Care. All Care and Rogue Retreat know what they're doing. Rogue Retreat knows how to run these facilities. We don't know how to run these facilities. We don't know what they need for success. We need to come together with them, have some meetings, figure out the details of the contract, and then move forward from there. Thanks.
Anybody else? Joel?
There's one thing that has bothered me. We approved Foundry Village, and so I went to the ceremony, and there was a press event there, and the nonprofit CEO very honestly and innocently said, well, we're getting funding for the Urban Campground, and the council hadn't even voted on it. So I think we need to be careful about how we criticize each other, and I'm not criticizing anybody with that, but that was an inappropriate comment where it got ahead of the council. Probably based on, I would guess, some conversation with some folks on the council. So we need to be careful and support each other, because like I say, whether it's staff or council members, we all win or we all lose together. And we need to be constructive and move forward in a way that helps our community and provides that hope. So let's do that.
Rob?
Yeah, I'd like to thank Brian for apologizing to All Care. They definitely got caught in the middle of a situation that they didn't create, and they were just trying to basically be helpful. But, I heard many times what Joel has said about a community process and trying to work things out, listen and work things out in an amicable way where the whole community can buy into a solution. And I know that Joel has several times said that when it comes to an urban campground or things of that nature, we have to be realistic when we tell the public and when we talk to the public. We can't promise the public that an urban campground is going to, bring back our parks. We can't promise the public that an urban campground is going to solve our homeless problem, that we have to be realistic. Well, I'd also like to be realistic when it comes to trying to have a community consensus on an urban campground. As Brian said, there is always going to be pretty much whoever's backyard that urban campground is in, they're more than likely always going to not be happy about it. And when we look at, other, we'll say, consensus type of issues, whether it was Home Depot years ago, and there was a kind of a firestorm about that, or whether it was the Rogue River Retreat, or for that matter, even Foundry Village, the people in that neighborhood were not happy that, they've got Foundry Village and the sobering center all in their area. So no matter how good the process is, I want us to be realistic that there's still going to be a segment, and could be a large segment of the community that's not going to fully embrace a location for this, and that, Joel, it's still going to come down to the council making what could be a hard decision, regardless of how good a process we try to set up. We're still going to have to make a decision at some point in what we feel is the best interest of the community, because I just don't think realistically that we're going to find a location that is going to, that everyone is going to embrace. So I just like to be realistic about what we hope for in having an open process. An open process is very important, but that doesn't mean we had people up in the Manzanita area. I remember when I went to first meeting that was at the Brighton School last year, and there were doctors and dentists and chiropractors that were against having that Manzanita Center, and they said, absolutely, we will help find a better location for this facility, just keep it out of our backyard. And as soon as it's gone from their backyard, I don't think that we've heard a peep from any of them. They're just happy that it's gone from their neighborhood. So we're still going to end up with some of that pushback regardless of our process. So I just want to be realistic, have a realistic expectation for what we're going to end up with. We're still going to have to make a hard decision at some point.
DJ?
Yeah, let's see, where do I start? I, for one, will not be joining the apology train to All Care because there are many reasons. They're going to be the beneficiary to $1.25 million of our taxpayers' money. They participated in this extremely expedited decision-making process. Some of the colleagues on council, as well as our All Care, did not have any consideration for what the constituents thought about whether we should be doing this or what property we should be putting on. And furthermore, I take great exception to blaming staff for this. They were working on explicit instruction from council to reveal the grant and the property if we had a sales agreement in front of us. So staff presented that with explicit direction from council to do so. So any blame made on staff for this is ill-placed. If you want to place blame on anybody, it's council's fault, and council's fault entirely. Anything less than that is pure excuse. My position on this has been explicit from day one. Constituent input, proper process, due process, and it wasn't done. So anybody up there that wants to sit on the dais that voted yes for this thing and pushed to get this property in front of us, they should be apologizing to council for trying to do this too quickly. I told you so. And here we are. We're in a bit of trouble. We need a healing process to go through. It's time to lick our wounds and do it right this time.
All right, so we need to have a discussion about a better process, and I think the one thing that I've heard suggested was Brian had suggested meeting with All Care just to work out the parameters of a contract that would be not attached to any one property, but just better terms for the grant program in general. Is anyone interested in that? I'm seeing a hand from Rick and Brian and Kurt and Valerie. Joel seems maybe like he's not sure what I asked. Do you need clarification, Joel? Vanessa's got her hand up.
I'm thinking, Mayor. I appreciate your sensitivity.
All right, I mean, I guess that was, to be honest, what I was kind of expecting last Wednesday was just that we were going to be dealing with a grant. So, and just negotiating the terms of what your expectations are for, you know, for providing that money.
So what I would be more familiar with is I would maybe use different words and just have an informal discussion. The contract itself is a public document and needs to be, you know, it's also a technical document, and you don't put together a technical contract document with 5 counselors. That can be a recipe for disaster. We don't do that with the water treatment plant. We don't do that with, anything else. So I don't see any difference here. Communication in terms of expectations, that is also in the public arena, I think are a healthy thing. And I would be in favor of something like that, to actually talk about the exact terms of the contract and that kind of thing. I think we need to stay above that and stick to policy.
Well, I think it is a policy question. For example, the issue in that contract of how, under what circumstances the city would get access, would get the land back, was something that was written into that contract that I'm not sure that's something the council asked for, but I think it is something that we need to negotiate and figure out what your expectations are. Vanessa has her hand up. Vanessa, go ahead.
Yes, thank you, Mayor. I think there's a couple factors for us to consider during this process, and I think the first one that we really need to revisit is that the council had agreed to have a hands-off approach to the urban campground. We've decided that we want to be a facilitator in the community to get it started and get it up and running, but for the most part, we did agree that we wanted to be hands-off. So we're moving. During the urban campground discussion, we moved from deciding to have a hands-off approach to having a very hands-on approach during the meeting that we had. So if there is available evidence as to where the council had directed for the meeting to go the way that it did, I would like to see that evidence because I don't believe that that's how the situation was directed by council. I think the second thing that we need to consider is that House Bill 2006 does define this exact facility as an emergency shelter. And so under that state legislation, they have been awarded special consideration for land use decisions. And I think that all care, it is, at that point, it is their responsibility to follow that state legislation and the considerations that they've been granted until July of 2022 to get that shelter up and running. So when something is an emergency, the process will change a little bit. It will not be status quo, things will change. So to say that we should have increased public involvement outside of an emergency situation is a wonderful idea, but in an emergency situation and something that's removed from council, I think it's a really big ask that I don't know we can adhere to, because we're moving back to that first consideration of having a really hands-on approach to the situation that I don't think we originally agreed to. So I think throughout this ongoing discussion, we really need to remember that we want a hands-off approach to this, and I think that we need to mostly leave it up to all care outside of the grant agreement. With that being said, I think that we would benefit from getting together with all care and deciding some really basic parameters for the grant agreement, because we are asking them to provide some serious investment into this project, and I do think that they should be at the table just with the ability to advocate for themselves moving forward. Thank you.
All right, so I guess we just need to decide how we're going to do this. Do we want to put together a subcommittee that, of 3, I think we can have up to 3 counselors and myself. Does that sound right for a small group?
I see this, council could set something like that up if they so desire. I see this similar to listening to council discuss the different ideas and ways to approach this. This is very similar to an RFP process, and normally the way it works is council will provide staff with some general guidelines on what they'd like to have in the RFP. We know what the ultimate goal of the RFP is, and then staff drafts an RFP. We bring it forward to council. Council reviews the RFP, says, yep, we publish that RFP, and then we get responses back. And following a similar process that's proven to provide good quality responses may be something to do. And so we would treat this contract similar to an RFP, which is sort of what it is. We're going to be developing, if you want to do the same thing that was council was thinking about doing, is doing a grant program for acquisition of property for establishment of urban campground for someone to apply to, All Care Foundation or whoever else would be there. It's very similar process to where council could say, okay, we're going to do a grant program. This is what's going to be in the grant. This is the expectation of the grant. And here are some of the qualifiers for having an acceptable location. And you can have the things listed like a certain distance from schools, certain distance from daycares or children's activities and those kind of things. And so that would all be put into this package for your review and consideration when we have general ideas or discussions on what you'd like to see in that. And we could draft that with additional council direction.
Right, so I think we could throw ideas out today. Unfortunately, we don't have that draft contract in front of us. We could schedule it for next Monday or a different Monday and talk about it, you know, with all of us, or we could create a little task force subcommittee to work on it and then, you know, obviously put it back in front of council. DJ.
I think that's really good input about the RFP model. It's my opinion that one of the major mistakes that was happening in this was just immediately identifying All Care as the organization that is going to handle this. I was in favor of an RFP process for the reasons that Aaron stated. I don't really know the mechanism by which we should move forward from here, but we need to establish expectations, guidelines, etc. I think a forum, like Sarah suggested, a task force of some kind, more of an informal roundtable with the players involved, constituents, All Care, council. I think that would need to happen. And I say informal as in a roundtable they could come, share information and expectations of what's the best thing to do for this community, but not a forum where decisions are going to be made. I think that's a really good starting point. I think using some sort of basis of expectation as we would if we were to have gone with an RFP would be a really good idea, but I truly believe that that's a step in the right direction.
Joel?
The other point that crosses my mind, along with what DJ said, was establishment of an urban campground is kind of treating the symptoms, not prevention. And with what we heard today and the vast need and the increasing need for what's coming towards us as a city that as part of that RFP, I would like to have, and the prevention of mental health and addictive situations. So not only if you want to move ahead with the campground, that we also put on there that additional one, because it is much more cost effective. It will affect what's going to happen in the future, and the same nonprofits can provide those services. It's just a thought as I was listening to people.
Brian.
So the process we went through was, or the product of that process was unworkable for All Care. All Care was not able to work with the product that we were trying to pass in that business meeting, because we as a city do not know how to run this site. We don't know. We are not the experts. So for us to try to put together an RFP, unless we're getting that input from All Care and Rogue Retreat who know how to run something like this, then we're setting ourselves up for failure again. So I would very much encourage us to early on in the process to get together with All Care and Rogue Retreat, see what they think is needed for this to be a successful project in our community, because staff aren't the experts, council are not the experts on this, All Care and Rogue Retreat are the experts, and I know that they have ideas about what needs to be in that contract, and I know that we don't know what they are yet. So that needs to happen early on. And I'm also very, I'm getting a little wary. There's a subset of counselors that I see that I know that are clearly not in favor of this urban campground, And I see them trying to muddy the water and drag this out and to dilute the political will of the council on this. And I want them to know that it is not unseen. Thanks.
Valerie, then DJ?
Yeah, I'm not, putting out for an RFP to me is kind of silly. I know Roseburg recently had an RFP to go out for a campground and to do this, and they got no response, none, zip. To have All Care and Rogue Retreat sitting at our doorstep, they're already managing the Foundry Village. They're at our doorstep. They have been along with us the entire process. So I don't really see any need other than elongating the process to go out for an RFP. I like the idea of a roundtable. I like the idea of informal discussion and having staff, some counselors, All Care there. And if you want to bring in a couple of other people in the community that have concern or whatever, that's great. But I think that we have all the pieces. We have somebody who I would expect at some point in time, there are other places that are begging for All Care, not All Care, for begging for Rogue Retreat to come and help them manage something. I know that for a fact. We've got it right there. So I think to stretch it out would make no sense. I know it went too fast. I think that's what happened the other night. We didn't even see the contract because it was put on the dais that day. I mean, we had no time to really do it right. And I think that was a perfect example of not taking the time that it needed to do it right. But I think to go all the way back to writing of an RFP and going through that process would be wrong. I think we just need to do a roundtable, bring people to a table, have a discussion. At the end of that time, the staff will have an idea of what, the council and All Care can do. They can write it up, and then we'll go through the process and move forward. And, as to what Vanessa said, to a certain degree, she's right. We purposely, wanted to step back and not have our fingers in it. We wanted them to do it. It's just because it happened too fast without that roundtable discussion and making sure the contract was right, that everybody had a chance to look at it, discuss it, and put it out there. That was our mistake. So I say we just take a step back and put together that informal discussion with staff there, have them drop a contract that is discussed at that point, and then we move on and try to do it right.
DJ, then Rob, then Rick.
Yeah, Val, I agree with you. I'm not saying that the thing to do is go all the way back to step one and do an RFP. It seems that there might be a little accusation on the board for that, but that's not true. I think it's the core of the idea to demonstrate our expectations is what we're after. Something we can take to the table, round table, task force, or otherwise. That way we can start with something rather than start with nothing. Also, I think that public forums are appropriate, as many as we can get. Take anybody that's emailed us about this issue and let them know directly and broadcasting to everybody that we have forums for public input, so we can also take that to the table. Because if we're talking about subsets of counselors, Brian, I want you to pay really close attention. You have said in public that you do not wish to hear anybody that has an opposing view to you on this urban campground, and I mean to tell you that that is a very dangerous place to be. Constituent input is what we're here to do. We are a representative governing body, and I think that your idea of the political will of the council is misguided, because we are all individuals, and that's why we have a body of 8. So if you're detecting something that might be against what you're saying, I would suggest that you participate more, especially with your constituents that, by the way, deserve an apology from you, because their voice is important, as is all the elected officials on this board, and I would encourage you not to forget it. So, get the word out, public task force, roundtable, experts at the table, whether they agree with us or not, need to be at this table. We are a community as a whole. This is a direction that we've actually had favor for. As Valerie mentioned earlier in the meeting, I was delighted to see that majority of the people that emailed us said, hey, this is a great idea, urban campground's good to this community. Well, that's good. We've we got that input on accident, if you will, okay? Now, get those people at the table, and they're gonna tell you, yes, let's do this, but let's think very carefully about where it should be, what are the expectations, and what's the role of the governing body? Because those are the questions we need to ask ourselves. Those are the answers that we need from our constituents, the people that have filled the bankroll that we're using.
So just very briefly, I'm going to need to ask you, DJ, if you're going to accuse me of that quote, you're going to need to cite that, and you don't need to cite it right now, but feel free to cite when I said that. Thank you.
Rob, then Rick.
Yeah, I'm hearing so much similarity to what we're saying. You know, when we talk about a roundtable discussion and we talk about wanting to bring in all care to get their input as far as what they would need, or Rogue Retreat for that matter, as far as what, you know, they would need to help us with this endeavor. We all seem to want to know before we try to ram through a contract rather than afterwards. We want to hear from what they have to say. We all seem, I really think, I'm hearing us all pretty much say the same thing or similar things. You know, when we have a roundtable discussion, I'm not even sure that that has to be exclusive of. In other words, it may even be at the same time as bringing or inviting the public to speak in some capacity. They may not have a seat at the roundtable, but to be in the actual room so they could hear directly the testimony that everyone's giving and the considerations that everyone has. But I think that that's the way to go, is to, I think we're all saying it, is to have a roundtable discussion. I think that I'm hearing to have representatives from Rogue Retreat and All Care in that discussion, and then either the exact minutes of that meeting or the bullet points then get brought back to the council, where then we would have to make a decision, and we can decide what weight we want to place on which testimony or what points to come out of the roundtable. We then have that decision to make. But I think that to have a subset of counselors at a discussion, at a roundtable with Rogue Retreat, we could probably invite the public to observe and or participate in some limited fashion at that, you know, live public meeting, or they could be online also. They can be invited both ways. But then at that point, we take that information, bring it back to the council, and then we decide what we have to do based on everything that we've heard.
Rick.
I also want to express the feeling that we have been elected as city councilors representing our community, and everybody needs to be heard. This is not a perfect world. We need to make decisions based on the input that we have and then go forward. So the whole process should not be mired down, but we do need to hear, and I favor the roundtable concept. I think that gives an opportunity for the public to express themselves, and also for the agencies involved as well as the city council. So I would support that. Thank you.
All right, sounds like we have support for some sort of roundtable discussion. I guess the question is, if we're going to have a subset of the council, how are you going to pick? Do some of you want to volunteer? Am I going to pick? Are we going to elect people? We need draw hats, draw names. Is that what you're saying, Rick? Draw straws. We can do it with everybody if we're not going to be able to agree, but I don't want to pick 3 people and have, you know, get accused of anything. Rob? So
I'm pretty confident. If we didn't have enough people, I would definitely volunteer, but I'm pretty confident that my view will be represented in part by a couple different councilors here. I have other parts of my view that I'm sure would be represented by others. I don't necessarily need to be at the round table. I'd be happy to do it if we can't get enough councilors to do it, but I'm sure that other people can represent my views.
Okay. Mark, if we have a discussion where no decision is made, should we still keep it to less than a quorum?
Yeah, you should. Because even if you had a quorum, even if you're bound not to make a decision, you're going to use those recommendations for later decision-making or to guide later decision-making, and that requires adherence to quorum requirements.
Okay. So who's interested? Joel? Valerie? Uh-oh, we're seeing too many hands. Joel, Valerie, Rick, Kurt? I'm checking my phone to see if DJ or Vanessa sometimes text. Okay, well, I have Joel.
Mayor, I'm interested.
Vanessa.
Sorry to interrupt. Yes, thank you.
Yeah, if I can just say just briefly, I don't think that there's any counselor that shouldn't be on this, of course, but kind of agree with Rob in a way that I would just gauge who has the most passion and interest on this subject and let them roll with it. I think anybody that's involved with that meeting is going to be taking information from us and is rightfully responsible for bringing it back to us. It's not a problem at all.
Okay, if I suggest Joel, Valerie, and Vanessa, would you guys agree to that? Joel?
The other thing is civility. I just appreciate the council's civility, and we set an example for the community, and that civility is very important. When we lose that, we lose a lot of our ability to make decisions, because we're all going to lose or we're all going to win together. And so, and I include myself in that discussion. That's really important. So thank you.
DJ, would you agree with Joel, Valerie, and Vanessa?
Yeah. If they volunteer and are driven to do this, I think that's the best method for deciding who should be a part of it.
Vanessa, do you agree to that?
Yes, I do. Thank you.
Rob?
I do.
Joel? Valerie? Rick? Kurt? Brian? All right. We'll have the three people can meet with All Care and Rogue Retreat, and we'll kind of hash out some details on just the contract aspect, and then we'll bring it back before the council again. Mark.
Thank you. I'd be remiss if I didn't address some of the consternation around revealing the location of this site. And I'm going to reiterate a little bit of why I did that. So I explained during last week's meeting why I set up the process as a two-step process. And first and foremost, that's because we're bound to adhere to federal guidelines for grants. And that requires that we make reasonable expenditures. So that's why I set up the grant, so that it was almost like a mortgage pre-approval letter in a sense. So they have to present evidence that the property is a reasonable price. And then I didn't know whether or not I'd get the site information prior to the meeting. I received it at 3:30 that afternoon, and knowing full well how important this was to council, I felt compelled to provide that information. It would be a big no-no for me to withhold that information, because it all goes to our common goal. I think it's common among all of us, of transparency and giving the council as much information as possible. So it's a bit baffling to me that there's been criticism toward revealing that. So that's my position, and I'm very steadfast in that.
I think we have a complicated issue of trying to deal with too many things at the same time, and so I think this will separate it out, and we'll just deal with the expectations of a grant without dealing with the location in one sitting. Aaron?
Thank you, Mayor. I just needed for the roundtable, I was wanting to get some additional clarity, so we know exactly the roundtable aspect. I heard a lot of different conversations here and I wanted to make sure the expectation of the roundtable is all the same, so we can help facilitate that appropriately. So I heard council talk about council's interest. I heard council talk about All Care's interest. I heard council talk about the public's interest. And so knowing who's going to be at the round table is going to be important, and who has a seat to have a voice at the round table. So I don't know if it's just going to be the city and All Care Foundation, or if the public is also going to be at the table. I even see a fourth leg that hasn't been discussed, and that is the unhoused themselves. Do they get a seat at the table to talk about what they need for this community? And so just want to make sure we get clarity on the different steps on what this roundtable is, so we can make sure we're not missing something. I want to make sure that this meeting meets council's expectations.
What? Rob?
So my perception as to how it would be most productive, and everyone can have their opinion, obviously. I would like to see the council representatives, Road Retreat, All Care, potentially city staff, all at a round table. I would like to see that in a situation where members of the public could observe, hear that whole thing, and also there'd be time for members of the public to then also comment. And I'm not sure to what degree they would be limited as far as time-wise, but I would like to see that discussion happen in front of interested members of the public. And they would then have an opportunity to speak as well.
DJ has something on the phone.
Yeah, Rob, I agree with you. Open to the public, absolutely. I think transparency is a very hot topic word right now, and I think it's time to be transparent. Aside from obvious real estate negotiations that should be protected by executive session, I'm still in favor also going outside of what Aaron has asked us, community forum. Be aware that we're going to have an ARPA survey results, statistically significant ARPA survey results that are going to tell us, if some people are interested in allocating ARPA dollars to social services. I think this is such an impactful topic that a standalone community forum, as we would for strategic planning or otherwise, come to talk about this topic exactly, $1.25 million ARPA money to social services. And there it is. There's your input, there's your chance. Come and talk to us. That'll be another piece of information that we need to take back to the table when we consider what to do and where to do it. So, as council would support that, I truly think that is an absolute must here.
Joel?
So I was building on both what Rob and DJ said. What I'm familiar with is public input and then a fishbowl exercise. Now, then my mind went to where public input may last a while. And so it may be two meetings. One is just to gather public input, and the second is just the fishbowl exercise.
Well, at this point, 5 members of the council did approve a grant to All Care 2 weeks ago, so I don't think we need to totally backtrack and, reopen this discussion. I think we can just focus.
We're not talking about reopening that. We're
on a
talking
grant,
about public input on the subject at hand.
We'll have council, staff, All Care Road Retreat at a public meeting, have an opportunity for public comment, but I think the focus is solely on rewriting the terms of that grant. No location, specific, but just, do we expect them to run a campground for 10 years? Do we, what do we expect for our money? I think we have to keep in mind that the majority of the council did already approve using grant money for a campground and not just start this discussion wide open. But do you still have questions, Aaron?
No, based on that direction, we'll establish a roundtable discussion with the stakeholders at the table. Would be some council representatives, All Care Foundation representatives, Road Retreat representatives, and then it would be a meeting that would be a roundtable meeting that would be open for public observation, and didn't quite get if there's going to be an opportunity for public comment at that meeting, or if it would just be public observation and then, so.
Sure, why not? We'll say public comment too. Do we need the council to vote on that? Rob?
Yeah, I think absolutely some amount of public comment at that meeting would be appropriate. To me, it would also be appropriate, if not live, then virtually, to have our city attorney there as well. I think that would be a smart move.
Yep, we'd have some staff there. Rick?
I still think one aspect should be included, and there are some parameters on the location, and while we may have a hands-off of sorts, we still, the council does represent the community. So I knew one councilor that was very adamant he didn't want the homeless camp downtown in the CBD district. So I think, you know, there may be some other parameters that should be considered, not saying it's going to be an absolute yes or no. There still needs to be a balance, but I think that input from the public and everybody still needs to be.
Two things. First of all, it will come back to the council to be voted on, so you'll have an opportunity to make any amendments then, but I think you can also share your concerns with Joel, Valerie, or Vanessa when they are working out the deals of the contract and try to get it written in the first time.
Okay, thank you.
Thanks. Anything further on this? Alrighty. I think I'm not seeing any hands on the phone, so how about we talk about agenda review? We have tomorrow night a strategic planning community forum that the council does not need to attend, but is open to the public at 6 p.m. Tuesday evening here in the council chambers, where the community can share their ideas for our strategic planning for next year and into the future about what they think our priorities should be as a council and as a city. Then we have a meeting on Wednesday night where we have a public hearing to consider an ordinance on the construction excise tax, public hearing to consider an ordinance that would vacate a property line at 5th and L Street, a public hearing for sale of city-owned property at both West Park and on Fruitdale. And then we have council action to consider a resolution on the Sustainability and Energy Action Task Force. And then our consent calendar has a resolution on city's employees' medical insurance and dental insurance, as well as findings of fact for the zone map amendment we made recently for 3322 Leonard Road, and then appointments to the Committee on Public Art as well as the Parks Committee. Actually, Parks Committee has been moved. All that. And then next Monday's workshop would be Dollar Mountain County property. The county has a couple of lots that they've put up for auction. We need to make a decision on whether we're interested in bidding on those. Discussion on airport funding, and a discussion about creating an urban renewal agency task force. And DJ has his hand up.
My apologies, I might have raised my hand too soon. I don't have anything to say about the immediate coming meetings. I have something general to say.
Is it about the agenda at all?
Yes, I'm going to just go ahead and say it. So it's been requested that the city manager evaluations be turned in by this Friday for processing and putting it all together in preparation for that. So if we could get those in by Friday, that would be appreciated. Thanks.
Thank you. All right, Mark?
Yeah. So heads up, there's going to be another agenda item added, which is mandated per the charter, and that is your veto, Mayor. The charter doesn't call it a veto, but it's essentially a veto. You wrote a note, a brief note explaining your reasons why you're not going to sign the All Care grant resolution. And so the procedure when that happens is that's automatically, automatically put for a vote to the council, and then the council can override that and reinstitute the approval with a 3/4 vote. At this point, I think we could probably all agree that it's probably kind of a moot point. However, the charter requires it, and so it's going to be on there. Certainly up to council. Not sure that it needs public comment. It could be just a council action, and a summary vote or deliberation, whatever council wants to make of it, but it seems of the character that it's purely a procedural housekeeping creature that is only here by virtue of your refusal to sign it. So, thanks.
I ruined everything. Okay, council action, I mean, would automatically have public comment. So I guess it's up to you, council, whether you want that as a consent calendar agenda item or a council action item.
I don't think it could be a consent item because it's sort of more of a nuanced issue. Consent's
You're right.
yay or nay. And
Right, okay, so it has to be council action and it'll have public comment opportunity.
it could be under matters for mayor, council, staff as well.
I'm seeing 2 nods for putting it under items for mayor, council. What do you guys think? Does anybody care, have strong feelings? Okay, so we will just put it under items from mayor, council, I guess. Okay, anything else coming up within the next week? No. Okay, anything else looking out into the future? Yep.
So the other night, well, like for today, for instance, I quite frankly had trouble understanding all of what Dr. Candelaria was saying, trying to listen to him speak through a mask. The other night we had somebody who said that he had emphysema, he wanted to take his mask off and speak. And I know that the new state guidelines that Aaron sent to us from Michael Weber a few weeks back has all the requirements for masking indoors and all this other stuff, and masking outdoors for that matter. Last year, you know, athletes had to, track guys had to run with, and girls had to run with masks on and all that crazy stuff. Anyway, that got turned around. Also, on those new guidelines, if we read them carefully from Michael Weber, if someone is giving a performance, a speech, a presentation, they don't have to have a mask on. So to me, I would like to change our, I don't know, our guidelines or our policy of having people who are at the podiums have to wear a mask, because that is not the state, that's not the state guideline. And I today, like I say, I really couldn't understand Dr. Candelaria very well. Rick is indicating he had trouble understanding him also. So I'd like to see people's masks come off when they're on the podium.
Is that a thumbs up or a question? Okay, Brian has a comment.
It's
Valerie
more of a-
and Rick were supportive.
It's more of a comment. I'm not opposed to that, but I would think that maybe just as a matter of safety, if we're having multiple people give public comment at the podium unmasked, maybe we would have some sort of procedure where it's wiped down between speakers, so we're not having 20 people go through there unmasked in a matter of, 45 minutes or something.
Yeah, I'll be prepared because I'm closest. That'll probably be the best. I'll just go up and maybe wipe down between, like, say, public comment between each person. If we just make sure that that's known, and they'll know that after each presentation, someone will get up and sort of wipe down the podium.
4 people have said they're okay with it. Joel? Joel's okay with it. Well, that gets us up to 5. All right. Clear shield, yeah, it's hard. People don't know what the rules are before they show up. Vanessa had something about agenda review. Go ahead, Vanessa.
Yeah, Aaron, I wanted to double check on if we had planned a housing and severe rent burden forum under HB 4006 for this year, if we're going to do that early next year, kind of like how we did this year.
Yeah, we are in discussions with the OHCS staff right now about possibly shifting to January. It sounds like they would be open to that. We should have a date nailed down by the end of this week.
Wonderful, thank you.
All right, anything else? Agenda review? All right. You guys want to adjourn? You want to hang out?
I move that we adjourn.
Second from Rick and Valerie. Any opposed? All right, see you on Wednesday.